and you guys are good to kick it off whenever you're ready.
Okay, thank you. Let's start.
Hello, everyone. We are Gabriela Godinez and Nora Curiel. We are part of the Upstate Family Resource Center. Thank you for being here, and thank you for the interest in the topic that we are talking about today. We're going to talk about the culture with the Latinos, about child maltreatment, and how community health workers using evidence-based programs could help avoid this problem. Okay, well, I want to introduce officially Gabi Godinez. She's a volunteer of the Upstate Family Resource Center. My name is Nora Curiel, and I'm Associate Director of the Upstate Family Resource Center, and Mike couldn't be here today with us, so Gabi and I will do the presentation. And just for you to know a little bit about our organization, the Upstate Family Resource Center is a nonprofit. Our mission is to help families thrive. We are part of the Children's Trust Family Resource Center network, and we follow the standards of quality of the National Family Support Network. We have three main programs. One is the Harvest Family Ministries. We have a food pantry, and we do some financial literacy. The other program is family development. We offer parenting classes, and we work with teen moms. And the Vida y Salud, that is a specific program to serve the Latino community in Spartanburg County. And we have been serving the community since 2017. And our focus is to connect the Latino families with health and social services. We follow the community health worker model, and well, our organization has a lot of partners because we cannot do everything by ourselves. So we connect the community with other providers. Next. And well, the Vida y Salud program offers many different services. We assess development of children 0 to 5 years old. We also have support groups for mental health and breastfeeding, and we have specific programs for perinatal care. We have home visiting, a home visiting program. We are also a food share site, and we are offering cooking classes for healthy eating. Also, we complete applications for Medicaid, SNAP, WIC, and well, in general, we connect the Latino families with many resources. And also part of the role is to facilitate the evidence-based programs. We do both in English and Spanish. So why our work is important? Well, as you can see here, around 7% of the state population are Latinos. And if you see in the map, we have counties where we have a highest concentration. We are in Spartanburg County, and we have, well, in average, 15%, and in some zip codes, we have up to 18% of Latinos. And we're talking about children here. So if we see we have around 100,000 Hispanic children, representing 9% of the children of the state. But the sad part of this is that 58% of Latino children live in low poverty areas, and these families have a lot of inequalities. Many of them don't have access to health insurance and education, food. So there is a lot of need with these families. So that's why our work is important.
Okay, then. Well, in order to present this information, we will review the following topics. First of all, we're going to speak about what the ACEs are and then we're going to review some characteristics of Latin American families and ACEs in Latino children and the relation with migrant families. Then we are going to focus in how important is the role of the community health worker using the cultural competence as an effective tool, as well as the use of evidence-based interventions. So let's start remembering what the ACE are. The ACE basically are emotional experience in the childhood that can impact our mental health when we are adults. We can group the ACEs into categories. Conventional ACEs, and we can find abuse. We can find abuse, physical, emotional, or sexual, also neglect, and it includes physical or emotional and household dysfunction. And we can find mental illness, incarcerated relative, interpersonal violence, substance abuse, and divorce situations. But also we have expanded ACEs. These ACEs are speak more about the context. As an example, the bullying, community violence, neighborhood safety, racism, or living in a foster care. So summarizing this slide, the ACEs are experiences at an early age, which can constitute risk factors that impact and predispose to health risk situations in adulthood. Now, we're going to speak about some characteristics of Latin American families, and we're going to focus on the change in family structure and parenting. Changing the family structure, we can see now that an increase in single parent household with female heads. Also, we have been a reduction in the average family size. I was telling Nora that my grandmother, for example, my grandmother had 17 children. My parents had 4. I have 2 cats now, but we have seen this, the families now are smaller. And finally, this point, I think it's really important. In Latin America, the significant social disparity are strongly connected to the unequal distribution of family and social services, which create a continuous cycle of disadvantage. This is a part that I consider is really important in our work. Then we have parenting situations. We can see in Latino families that multiple people are involved in the caregiving task, as an example, the grandparents, uncles, etc. Then some parenting practices can turn into violent situations. Number 3, in Latino culture, it's common that children help with caregiving tasks. Number 4, some parents can be very strict, but in the other hand, we have seen some parents can be very permissive. Families that are facing financial struggles with high alcohol consumption can use violence to cope with difficult situations. And this point is we're going to focus in this point later. In some cases, violence could be normalized. We can conclude that the adverse childhood experiences and the positive childhood experiences could affect the brain development, but also it's important to see the next data to speak about the racial ethnic disparities.
Okay, as Gabby was saying, these experiences can affect the health and well-being of the children as they grow. So here we can see this graphic, the prevalence of ACEs in the Latino families. We can see that 67% of Latinos have experienced at least one ACE compared with 58% of white. 34% have experienced domestic violence compared with 17% of white. So we see a big problem with the Latino families in this case. Also, 24% of Latinos have experienced physical abuse compared with 17% for the white, and 34% have experienced emotional abuse, and 16% sexual abuse. And you can see the purple lines here, how the Latinos have a lot of problem with the ACEs. Next slide. On the other hand, we know that positive childhood experiences can help contrarrest the impact of ACEs. Unfortunately, this graphic is showing that the Latinos have less positive experiences. For example, we can see that 65% of them, they feel like they don't belong, compared with 73% for the white, and only 62% of them feel like they have an adult to give them support, compared with 75 for the white. Also, the participation in community activities for the Latinos is only 53% compared with 63 for the white. So all these factors make the Latino community more vulnerable. So what is our goal with this presentation is to show you the importance of the community health worker role and how combining the work with evidence-based programs, we can create changes in the families we serve. So community health workers are people from the community who know the culture, language of the participants they are serving. So we connect with the families in a very special way because we have some shared experiences, and we connect these families with different resources. So we ensure that they have everything they need in their basic needs. So our work is to improve health outcomes, advance health equity, and reduce healthcare costs. We go to the community and provide education, informal counseling, social support, and we connect them with different resources.
Well, if we want to reach our Latino families, it's really necessary to have some cultural consideration. I would like to highlight cultural competence, the appreciation of the diversity, assess our own cultural perspective and biases, and also, and it's really important to note that because resources and cultural norms differ around the world, rules of protecting children and what counts as a child abuse vary. We are going to speak about that with Nora.
Yeah, and as Gabby was mentioning, the child abuse is perceived in different ways depending on the culture. I'm not saying that this is good, but it's for you to understand that sometimes in the Latino culture, the physical punishment is something common and accepted. And sometimes they use belts and other objects to hit the children, causing harm to them. So also the verbal and emotional abuse, sometimes there is a lot of shaming and threatening, and this can impact the children's mental health. And another factor that we have found is that they feel like they come to this country to work, and sometimes the parents give them some heavy chores of work as a punishment. So that sometimes interferes with the education of the children, or sometimes they don't go to school because they have to work. So all those practices are normalized in the Latino families, and that's the change we want to create. So this is not happening anymore. Okay, and well, just to have a good communication with these parents, we have to make sure that we are respectful and we develop a positive relationship with them. Just avoiding stereotypes, assumptions, and judgment, and be open to learn. When you are serving a community, you have to be open to learn about that culture and the reasons they have to be like that. And just be open to the conversation and share the knowledge you have with them. And well, I want to mention, we at the Family Resource Center, we offer some evidence-based curriculums in order to change this behavior. And we have to change the behavior of the parents to be able to change the behavior of the children. So why we use evidence-based? Because it's proven to work, and also because it is sometimes easier to receive funding to create programs when we use this evidence-based. And well, we're going to mention a few of the programs that we have delivered at the Family Resource Center. But before that, I would like to mention something very important. When you have a family that we have served before, so we are sure that we are covering the basic needs, that they have shelter, they have food, they have medical services. Then is when we have the opportunity to enroll them in these programs, because sometimes we are just wishing that the families enroll in this program, but they have many things to worry about. So that's the role of the community health worker. We first ensure that the family has everything they need, and then we offer these programs, and that has been very successful for us. So, well, maybe, I don't know if some of you have heard of these programs. I'm sure Triple P you have, and Strengthening Families, because this is very popular now. But I'm going to mention this first, is Familia Adelante. This curriculum was created specifically for the Latino community, and it is a 12-session program, and we work with the parents and the children at the same time, covering the same topics but in different rooms with a different perspective for the parents and for the children. And the goal of this program is to reduce the family stress, change behaviors of the children, making sure that of reducing the risk behaviors about sexuality, and decrease the use of substances, and also just trying to address the stress of the families when they are immigrants. The process of acculturation is difficult for these families, so this is a topic that we cover with this curriculum, and it has been very successful with our program. Another one is the Triple P, the Positive Parenting Program. Well, this program, as you may know, it is offered in many different languages, and it's also an evidence-based. And there was a study done in South Carolina, and well, this is a program that promotes giving prize to good behavior. So we encourage children to continue with that, and also having rules at home, and just respect, and having a structure with the schedule of the children, and well, just pricing the good behavior. That's the main part of the Triple P. And we have different levels, and for different ages. We have 0 to 12 and teenagers, and we offer these programs in English and Spanish. And well, I was mentioning that there was a study done in South Carolina in different counties, and showing a big reduction in the rate of child maltreatment, reduction as well in the out-of-home placements, and also the hospitalizations or the emergency room visit because of child maltreatment. And last, we have the Strengthening Families program. That is something that we are delivering right now in English and Spanish as well. This is well, they are changing it to 10-week program, and the age also is changing. It will be 7 to 17 years old. And this program works as well with the parents and the children. And it has shown that decrease the family conflict, more communication, reduces the risky behavior of the children, increase the social skills for parents and children. So we have been very successful as well with this program, and we think it's very effective. We have had some success stories from this program.
Resource Center.
Okay, and we would like to show you this short video about that success story that we had with one of our participants. Well, she has received many services, financial assistance. She was able to participate in the Family Adelante program, also in Triple P, and she's right now a participant receiving. She's going to our mental health support group, and we have seen many changes for this family. So we would like to share this with you.
That provides connections to essential medical, dental, social services, and emotional support to Latino families in need. It offers comprehensive services and opportunities to help individuals and families build healthier, more resilient lives. Thanks to the Vida y Salud program at the Upstate Family Resource Center, Maria's family received essential support, emotional care, and opportunities that transformed their lives, helping them overcome challenges and build a brighter future. 2 years ago, a Colombian family seeking a better future found a new home in Spartanburg, South Carolina. Maria, her husband, and their son had faced many challenges in their home country. Their lives changed dramatically thanks to the Upstate Family Resource Center and its program, Vida y Salud. From the first day Maria entered the center, Amira Thomas welcomed them with warmth and dedication. She provided essential services and became the emotional support they needed. Vida y Salud offered medical and dental care and became a source of hope during their darkest times. The financial support from the program helped them cover basic needs and opened doors to new opportunities. A 1-year YMCA membership for Maria's son helped him overcome emotional struggles. Swimming lessons and sports activities brought joy back to his life and strengthened their family bond. Maria and her family joined programs for parents and teenagers where they found a community that shared their sorrows and joys. With Amida's encouragement, Maria bravely decided to learn English and conquer her fear of driving to improve her job prospects. The transformation of this family shows the powerful impact family resource centers can have on vulnerable lives. Maria's story is a reminder that behind every statistic, there are real people with dreams and hopes for a better life. Today, Maria works hard to build a brighter future for her family. Vida y Salud not only changed her life, but also planted a seed of hope that continues to grow. Every dollar invested in programs like this helps transform lives and strengthen our community. Maria's story is a call to keep supporting and believing in the power of meaningful humanitarian efforts.
Well, thank you so much. I don't know if we have options to questions, but
Vida y Salud is a program at the Upstate.
Attendees, feel free to post your questions in the chat.
no, we are just in Spartanburg County, and in South Carolina, but we serve mainly Spartanburg County, some families in Greenville County, and also in Cherokee. Thank you for the comments. Well, usually the participants come to us for specific needs. Well, I'm going to read the question. Can you provide an example of how CHW engage with these families? Um, okay. In many occasions they come because they have a different need. They don't have access to healthcare services, or they are pregnant. So we receive a lot of referrals from the hospital, and they came for different reasons. But once they come to our door, we offer all the menu of services that you saw at the beginning. We we just work with them first to cover the basic needs, and once they are better, we invite them to participate in the other programs. But we sometimes do outreach. We go to school, churches to reach out to these families. But we are right now well known in the community, so we receive a lot of referrals. We also work with the schools, so we sometimes have referrals from the school districts about children having some behavior problems. So we take care of those families. We work very closely with the social workers as well. Yeah, somebody's asking, is your program long term? Well, I would say yes, because we establish long term connections with the families we serve. For example, we have a program for the perinatal care, and we followed all the pregnancy and the development of the child for 3 years. So we establish very long-term relationships with the families we serve. Thank you for the comments. And I want to mention that I think it's really important that we are people who share the same experiences. We are all my team is a group of immigrants. So we know how hard it is to leave our home, our families and friends. And sometimes, well, we connect with the families we serve a lot. There's another question that says, do the CHW link to any violence prevention programs outside of the organization? Well, not prevention as well. There are programs here that like shelters that provide services to these families, and they provide mental health. But I also think that our mental health support group give them a lot of information and help with self-esteem. We talk about topics about domestic violence, and we sometimes we just don't know that they are suffering that, and sometimes during these meetings they just share that information, but not, well, I wouldn't say prevention. Just when we are aware of that, we provide the resources for them. I don't know what a casa is. I'm sorry.
Someone is asking, where are we located?
We are in South Carolina, in Spartanburg County. I'm sorry, I didn't see that. You mentioned CHWs have live experience, which is important. You have internal supports for any secondary trauma. Yes, we have a mental health counselor working very often with our team. We have had some sessions to help deal with the secondary trauma and the burnout, because it's a hard work and big workload. So yes, we help our community health workers. Okay, thank you. Casa is a court-appointed special advocate for children. Well, I didn't know that, but we also offer another program called ABC, is Attachment Biobehavioral Catch-up, and that's for babies, and that some referrals come from the court. Thank you so much. Yeah, I want to mention my wonderful team, because they are the ones doing the hard work. I think there are no more questions.
Do we have any final questions before we wrap up from the attendees? Okay. Thank you,
Okay.
ladies, for presenting. I enjoyed your presentation. Great job.
Thank you so much. Thank you. And I want to thank Gabby, because she's a volunteer with me, and and she let me bring her here.
Very nice. And
Thank
thank
you
you to
so
all
much
the
for the
attendees.
opportunity. Bye-bye.